Hello, I'm Behruz Qamari Tabrizi. I am the director of Sharmin and Bijan Mossavar-Rahmani Center for Iran and Persian Gulf Studies. Today I have the distinct pleasure of introducing our next speaker for these virtual talks, Professor Djavad Salehi-Isfahani, who is not a stranger to our center because Professor Salehi was a visiting fellow a couple of springs ago, and we were just chatting about the beauty of Princeton campus during the springtime. And this is a very different kind of spring we are having in Princeton at this moment, but nevertheless, the beauty of the trees are there to behold. Professor Salehi-Isfahani has a PhD in economics from Harvard University and has taught previously at the University of Pennsylvania and Virginia Tech, and currently he holds a professorship in economics at Virginia Tech. He is also a non-resident senior fellow at the Global Economy and Development at the Brookings Institute, research affiliate at the Middle East Initiative at the Belfer Center, Harvard Kennedy School, and research fellow at the Economic Research Forum in Cairo. He writes on many different topics on the political economy and economics of the Middle East. He's a prolific writer, and I am confident that many of you have seen his writings, essays, editorials in different media outlets, including at Monitor, Brookings Briefings, Foreign Affairs, New York Times, and LA Times, and many other outlets. For me, whenever I want to have a clear idea about the Iranian economy, I await the day that I see a short piece or a long piece by Professor Salehi to see the minute details of how economic trends are unfolding in Iran, and most often issues that are missed by many other observers. So today, again, as I said, it's a distinct pleasure to have this conversation with Professor Salehi, and particularly I was quite intrigued by the recent article that he wrote on the coronavirus crisis in Iran. And I wanted to ask him to talk a little bit about the crisis, this public health crisis in Iran, how Iran is dealing with this issue. I know that many of us have questions about the numbers and the statistics about this crisis in Iran. Everybody is very skeptical of all these things. And whenever we want to remedy our skepticism, we can go to experts like Professor Salehi to help us to unpack these very complicated issues. And welcome, Djavad.
Thank you. That's a very nice introduction, and thank you for the invitation. I look forward to this conversation. Do you want me to start?
Yeah, if you can, yeah, you can share screens. It's pretty informal. We can, have a chat and conversation, and while you work on your shared screen, yes, we can do that. And very good. Now I think everybody can see your screen.
Very good.
Yes.
So I think what's important to do is to describe the dimensions of the crisis that Iran faces with respect to its economy. I'm going to look at the sanctions, the COVID-19 crisis since mid-February, and the collapse of oil prices that happened in mid-March. And then I look forward to having a discussion about the geopolitics, because the purpose of looking at these data is to get a sense of where Iran is with respect to resisting maximum pressure from the Trump administration, because that's really the big policy issue right now. As you know, world leaders, the UN leader, former US diplomats, they have written appealing to the Trump administration to ease sanctions in the case of Iran. And there's a lot of resistance on the side of those who have imposed the sanctions, who look forward to perhaps regime change in Iran. And having these basic data, I think is very useful in having that discussion. So let me begin by saying that my own view is that sanctions have failed to achieve their goals and are therefore needlessly punishing ordinary Iranians at their most desperate hour when they are battling this deadly virus. So how bad is the situation with respect to the COVID-19 crisis? I have here the data that anyone can download. I've downloaded data from the European Center for Disease Control. And what I have done is divide the number of daily cases and the daily deaths by the population. So we're looking here at two countries. I always think of Turkey as a comparator case for Iran. It has a similar economy in terms of size, a similar population, doing slightly better these days than Iran does. If you look at the cases per million, you see that Iran experiences crises much earlier than Turkey. This is the blue line, Iran. Turkey comes later, and the number of cases are a little higher, about 50% higher than Iran. And it looks like that Iran's cases have declined for now about a month, which is very good news for Iranians. If, of course, you believe the data. We'll mention in a moment why one should believe the data. Turkey's numbers are coming down as well. If you look at the number of deaths, Iran's deaths spiked very quickly after the disease was announced. As many people know, Iranians hesitated publicizing the disease for about a week or two, and that's the reason why the number of deaths are suddenly increasing so fast. You can see a very similar situation with Turkey, and I think that's one of the reasons why one can trust Iranian data, because they wouldn't have invented a graph if they were faking data that 2 or 3 weeks later would look like another country, a neighboring country. So there's something very similar about these two countries, especially if you look at this next slide, where you look at the death rates from infection. This is when you divide the number of deaths each day by the total cases. Not the best indicator, but serves a purpose. You can see here that Iran and Turkey look so similar in behavior when you're looking at the death rate, taking the total cases, announced cases, as the denominator. Now, the other reason why one should trust these data is because these data are easily verifiable with a lag. With a lag of maybe a few months, the birth and death registration data will come in, and Iran's deaths, let's say, of 40 per million, that's not a small number. If, as some people suggest, it is 10 times as high, then that will definitely show in the age structure, like the data of the number killed in the Iraq-Iran war, that is easily seen in the age structure of the various censuses that have been taken since then. So I tend to believe these numbers, and I also believe that Iran is lucky to have a professional class that's highly trained and is behaving professionally in terms of giving data out. How do I know that? Because I use some other data very intensively, data on labor force, and I'm going to show you a little bit data on household expenditures and poverty. I worked with those data for a number of years. I happen to have on my computer the raw data of all these surveys over a period of 30 years or so. And it's very hard to fudge those numbers. And I have talked to people in the Statistical Center of Iran who produce these data, and they're really committed to producing good quality data, because Iran's government itself needs to know what's going on, even if it doesn't want the people to know. It at least needs to know itself. Iran happens to be one of the few countries in the Middle East where raw data, unit record data on many things are published, and it's given, and researchers like myself have access to it. So, moving to sanctions, I think when you look at sanctions, the first thing you should know is that Iran's economy is not near collapse. It's a complex economy. It was doing okay. It was actually doing better than okay. It was growing until 2011, before President Obama imposed very severe sanctions on Iran, specifically financial sanctions that prevented all banks globally to move Iranian money around. The economy has become stagnant since 2011. So there's a very clear picture that I'm going to show you next, that you see an economy that's growing suddenly stalls. And that is because of sanctions. So if you hear people being confused, sanctions haven't had an impact, or sanctions have caused a collapse, that graph is going to settle that for you, I believe. Interesting part of sanctions, unlike the COVID, is that it has a silver lining. Employment has increased, and I'm going to argue that that's a very expected thing. It is not something that the government has faked, because not only the numbers are coming from very extensive surveys, but also there is very good economic reason why employment should increase when Iran loses its oil revenues. I'll explain that in a couple of slides as well. So surprisingly, Iran's GDP last year grew by about 1%. And if you were following Iranian news, you would have read that IMF predicted that Iran's economy in 2019 was going to contract by 9.5%. And again, this is a demonstration of disparity between the views from outside, from inside. The 1% growth is a product of Iranian data. That data I do not see at a very detailed level, so I can't swear by it. But if employment is growing, it stands to reason that the GDP may not have fallen by much. All these will be settled at some point later on. But right now we are looking at a complex phenomenon, meaning Iran's economy from very different perspectives. However, whatever happened so far, we know this year is going to be the worst year Iran is going to have since the Iran-Iraq war, because as with other countries on the globe, COVID-19 has no silver lining. People leave their jobs, firms, businesses, enterprises disintegrate, disappear. It's very hard to put those things together. We can discuss that later on. This is the graph that I promised a minute ago. Here I'm looking at GDP per capita in Iran and again Turkey. This is a good indicator of the standard of living. And what you see here is that two countries were growing in a very similar pace, at a very similar pace from 1990 to 2010 for 20 years. And then suddenly they diverge. Turkey is doing very well. Iran is not doing well at all. The reason why this graph is not often popularized is because there's a very strong lobby to argue that any day Iran's economy is going to collapse. And this mistaken policy, in my view, of the Trump administration to pull out of JCPOA is going to bear fruit. But these numbers are not mine. They are from the World Bank. All I did is to pick the right series. if you pick the series that correct for relative prices, you know, gas, gasoline, lots of prices in Iran are much lower than in, say, United States. And what economists do at the World Bank is to try to correct for those prices. This is as if you're measuring Iran's GDP, Turkish GDP, all with US prices. And one final point that's interesting about this graph is this last part here. Why did the GDP suddenly spring up? This is a 13% growth rate. And the reason why this happened is because JCPOA was active for 1 year. For 1 year, Iran enjoyed relative ease of sanctions and the economy bounced up. What does this tell you? It tells you that you have an economy that's almost like a jack in the box. It's pressure down, and if you remove the barriers to it, and the barriers are not all internal. There are lots of things wrong internally with Iran's economy, but the main blockage is the sanctions. Again, I'll remind you, the same government, the same level of mismanagement and corruption that people talk about was operating all these years, but the economy managed to grow. A lot of economies have corruption and mismanagement, but they might manage to grow because there are a lot of people who want to build things, and they do get around, sometimes pay the officials in order to be able to run their business. Anyway, so this is the picture that one should keep in mind when discussing Iran's economic crisis. Let me tell you my last story here, which is why employment grew. First of all, if you look at survey data, this is data that I have and unit records, so I get my own numbers from the files using a statistical software. These are quarterly data. So you see employment in agriculture, for example, very seasonal like that. Employment in the industry, which is the black line, is fairly solid, and it has been increasing. In particular, since sanctions were imposed in 2011, employment has increased by 3 million. So it's not an economy that's responded badly in terms of employment. Again, I'm going to speak a little bit about the economic reason behind it. Industry added about 500,000 jobs since Trump's sanctions. That is quite remarkable. And again, if you want to understand why that happened, you have to realize that when you have oil money, you import stuff. Imports are cheap. Local production is at a disadvantage and shrinks. When you don't have oil money, price of local goods increase, price of imported goods increase, and production gets a boost. If you want to see in more detail what's going on behind the scenes, you have to look at something known as the real exchange rate. This is the number of reals per United States dollar. And this here is the years of the oil boom. Real was becoming expensive relative to dollar. If you like, this is the price of dollar in real terms, and it's declining. The nominal exchange rate is here. What the red line does is correct for the relative inflation between Iran and its trading partners. The first sanctions cause a collapse of the real, which makes dollar more expensive. Then again, it starts going down, and the second collapse comes. This is in 2017, 2018, with the talk of return of sanctions by Trump. And this time, there's a big effect. And these two together, if you look at the relative price of things that you can import and the relative to price of services that you cannot import, you see this fluctuation of the real exchange rate very much present here. The oil boom makes tradable goods like cars, shoes, clothing cheap in Iran. Hence, a lot of imports, a lot of it from China. And then the exchange rate begins to go up, so do the price of tradable goods. And the biggest increase are here now, which I think was is the reason behind what I call the silver lining of the sanctions, something that the COVID crisis lacks. Finally, we come to the oil price collapse. So we discussed the crisis of sanctions, crisis of COVID, and this is a triple whammy. Iran was counting on 10 to maybe $15 billion of oil revenues, much, much lower than it is used to. 50 to 100 billion is what Iran has been used to the last 10 years or so. This year it was expecting at least 10 billion, and the oil price collapse has reduced that to 5 billion. And I don't need to read this slide for you. Just the takeaway is that Iran is the budget, the government budget, which was approved a month ago, is already down by 5 billion, which is probably why Iran has made a request for an emergency loan to the IMF, first time in 60 years, for exactly $5 billion. Maybe the numbers are accidentally the same, but Iran is in desperate need of these $5 billion, and it is part of this political football right now, with US saying, no, you shouldn't borrow because you have money, or maybe if you don't borrow, you would be more likely to accede to Trump's wishes and so on. And Iranians are debating it among themselves. Some want the 5 billion from IMF, some say, let's just go it cold with the resources that we have. The tragedy that is at stake here is the fate of the Iranian poor and Iranians who work in small enterprises that the government has a very hard time reaching. About 3/4 of Iranians, about 50 million people, are working in very small enterprises, less than 5 workers. These are not quite registered. Some of them are not registered. It's very hard for the government to reach them and say, don't fire workers. Here's their paycheck. Things that Europeans have done, Americans are not doing it, and Iran is trying to do it, but with larger enterprises. I want to show you a table that it became, that's trying to settle a controversy. So when Iran wanted the $5 billion, very quickly, Trump administration, Secretary Pompeo came and said, no, Iran has a lot of money. The supreme leader is flush with cash. And some weblogs have started also putting astronomical numbers, like 300 billion owned by the supreme leader and so on. So I looked at the origin of these numbers, and when you do them right, meaning divide them not by official exchange rate, by the free market exchange rate, you find that the biggest entity, this is the holding under direct control of Khamenei, is about 19.4 billion worth in today's dollars. The Bunyad Mossavar-Rahmani, the largest Bunyad Iran, also under control of Khamenei indirectly, is 7 billion, and then a small amount for the Astana Quds Razavi. So the total, in my estimation, is under $27 billion. And that is in real estate. More than half of it is in real estate. And it makes no sense to expect Iran to be able to cash these in terms of dollars and then be able to import medicine with it. So that's where this debate is. And you can read it up also in some stuff that I have written, and another piece that I hope to get out this week. Is Iran able to manage the social cost of this terrible crisis? Obviously, the government is not in a good position to take care of the population because it itself is very broke, as I have indicated. It plans to borrow from the public quite a bit of money. It sounds very unrealistic because it's 3 times higher than it was last year. My prediction is that it will not be able to find takers for its Islamic bonds, and very likely will end up borrowing from the central bank, which is another way of saying it is going to print money and put an inflation tax on the middle class. On the positive side, Iran is unique in the region for having experience with cash transfers. This is an effective and an efficient mechanism for social protection. It has been in place since 2011. People are used to it. The government puts monthly amount in accounts that people withdraw from ATMs. The amount varies. It's been declining, but this year it's going to be about 16% of median per capita household expenditures, or about $50 in purchasing power parity dollars, which is not nothing. It is enough to stave off hunger. The government has added to this amount. It has allowed people to borrow against these monthly cash transfers to the tune of 10 million riyals, which was deposited just before the month of Ramadan that started on Saturday in Iran. This is a loan against the monthly transfers. It is going to alleviate extreme poverty for the next month or so. There are also one-time transfers for needy households of up to $200 purchasing power parity dollars, about 1 month of median per capita expenditure. These are not small amounts, but the government doesn't quite have the money for all of these. It's quite likely we would expect inflation in coming months. So I am done with these
wonderful
slides. That's the good news.
No, thank you so much. It's so eye-opening, and you know, whenever one thinks about these issues, it sounds and looks as if we are talking about two different countries. When you read, let's say, New York Times or Washington Post, and works of people who closely follow the data from inside the country, then you see a significant disparity between the description and how the projection of the economic plans and so on and so forth. So that was quite fascinating. Thank you so much. I want to go back to the first crisis on COVID-19. In your earlier piece, you compared Iran with Spain.
Yes.
And that was, I thought that was quite a curious and very counterintuitive kind of comparison. I mean, Spain, or for that matter, perhaps Italy, European countries with presumably more sophisticated public health infrastructure, showing that they had a more difficult time in terms of instituting plans to contain the spread of the disease and the high numbers of deaths in comparison to Iran. I wonder if you could talk a little bit about that whether can we talk about an Iranian solution to COVID-19? Because now people talk about the Swedish way and versus the total lockdown in Italy or Spain or Germany. And was there a kind of an Iranian solution to this, or it just so happened that the numbers of death in Iran are much lower than these comparable cases?
Yes, that's a very good question. You know, I'm not sure I have a very good answer because I'm not an epidemiologist.
Mm-hmm.
But I do talk to people in Iran. I'm in contact with my mother, for example, who's knowledgeable about the small city where she lives. So I have a sense
mm-hmm.
of, does she know people who are sick? Does she know people among those who care for her, whether in villages around the city, there's a lot of epidemic. That's one of the checks I have, my own anecdotal check on the data. Now, the first thing about Iran to notice is that they do what they always do. Whenever a big issue comes up, there is disagreement. It's a squabble between the government and the force, what they call in Iran, hakimiyat.
Yeah.
Which
different sources of power, basically.
That's right. There's dual power, and it showed itself. And so it took him a while to figure out what to do. Rouhani was saying very clearly he did not want to do quarantine.
Mm-hmm.
They could have easily closed off the city of Qom, where the virus initially arrived and from where it spread. They didn't do it because Qom, as you know, is a holy city. It's a religious center. And people who control what happens in Qom are not in the government. Mm-hmm. They are among the clergy, they're powerful. So there was a bit of a delay in settling the issue of whether they wanted to have this or not. When I wrote that piece for Foreign Affairs, the situation was getting rapidly worse. Mm-hmm. And I criticized Rouhani for opening the highway to the beautiful northern Caspian region so that Tehranis could take the virus in speed and faster to that region.
Literally speaking, in speed.
Exactly, which they did. And then Gilan, this beautiful province, became one of the hardest hit. It has overcome that now, but the Rash, the capital of Gilan, was one of the worst cities. So there was a lot of things that went wrong initially, but then they all decided that they needed to have a kind of quarantine. They asked people to stay at home. They didn't police people to stay at home. And this is one of the remarkable things, that people who think the entire country is against the quote unquote regime and are about to topple it, they behave themselves. Mm-hmm. We were able to observe a fair amount of social cohesion as soon as the New Year celebrations were over by, a week after, by the end of March. Mm-hmm. And I think that played a very big role. So for about a couple of weeks, as you saw, there was a very rapid uptake in the number of deaths because hospitals were overrun. And the other thing that you might say that Iranian way of doing this is that they have a fairly good health industry and a health network. The health network was established in the 1980s. Iranian is the revolutionary government, which took electricity and clean water to all these rural areas, also built 18,000 health houses in the 1980s in rural areas. Nearly all of the rural population, maybe 95%, had access to a rural clinic, a rural health house, where there were two trained health technicians, not doctors, but quickly summon a doctor or could send a person to a doctor. So that has created a network, and Iran has data on almost everybody in this network. Everybody, they know when a woman becomes pregnant. A lot of it, by the way, was focused on mother and child health and later on fertility. So this database is an amazing thing. And you can actually go to the health ministry and you can see every individual's health record is on the computer. Public hospitals are not of good quality, but they're accessible. Iranians who have money do not go to public hospitals because they're crowded. They go to private hospitals. But the backbone of this health crisis, of protection against the health crisis, were these health houses and the public hospitals. And finally, Iran does have a health industry. Iranians now manufacture masks, manufacture test kits, they manufacture gowns, PPEs. So that also helps. Because there is sanctions, Iranians have turned inward for several years and have developed, just like during the war, they developed their arms industry, the war with Iraq in the 1980s. In the last 10 years, local manufacturing, wherever they see an opportunity, they have moved in there. People who travel to Iran see so much variety of food stuff that Iranians produce. This is agriculture has become industrial, and you can find anything from yogurt and milk and the orange juice and various stuff, food products, canned food in supermarkets. I think this diversified economy, this strength has allowed Iran to be able to do more testing than a lot of neighboring countries. And, Iranians also spend a lot of money on healthcare. There are
Right.
doctors all over. When you go to my hometown of Neyshabur, there are doctors' offices, several of them every block. And then there are pharmacies everywhere. So there's a strong health sector, if you like. And there was a fair amount of social cohesion to not disrupt the defense against COVID. That probably is the main reason.
One of the reasons, because I actually originally I learned about these health houses, Khanehai Behdasht, from your writings, and I was wondering how much of that kind of relatively strong public health infrastructure was undermined by the sanctions. And so these, obviously in the late 1990s, in the 2000s, these centers were operating rather very efficiently, especially in terms of family planning and basic medicine, like
yes.
sort of the old Chinese idea of the barefoot doctor, and that kind of intervention was very kind of effective. And but are they still that continue to be that effective, or the sanctions or mismanagement, sanctions, different kinds of things had reduced their significance in public health sector in Iran?
Yeah, that's an excellent question. A couple of things. First of all, what the health clinics did, more than just cure people, is to introduce them to the medical science. Maybe too much of that. You had these traditional people in rural areas, a lot of people who were illiterate, started talking medicine, temperature, different kind of medicine for this, for blood pressure. These were the stuff that these rural clinics could dispense. And after incomes rose, all these people, rural people, stopped going to the barefoot clinics and came to the cities to the doctors. And there has been maybe an over supply of this kind of medical stuff. Iranians go to doctors, as you know, they hate it when they are told to just go rest. You have to have 3 medications with them.
That's right.
This basic medication is produced inside Iran, and sanctions did not hurt it. The part that has really been hurt badly is advanced medicine, like cancer drugs, or drugs for Parkinson's disease, for things that research and drug development is moving fast, the frontier is moving fast, and to get those kinds of medicine produced in Iran takes time, and also good equipment. Iran has a lot of CT scans because it was able to import them. Now, technically, they can import all kind of radiology equipment and so on. But people who are in the business tell me and tell everybody that you can find the stuff and you can find someone who's willing to sell it to you, but says my bank is looking for due diligence, is going to take 3 months, 6 months. And at the end, they might say, well, you didn't assure us that this equipment is not going to end up in a hospital owned by the Satat, which is the organization under Khamenei, who is under sanctions, or an IRGC hospital. So the banking sections have made a mockery of these exemptions on humanitarian ground. And that is what is hurting Iran's attempt to fight COVID, but maybe not so much COVID as other diseases that require up-to-date medical supplies and medicine.
That's right. That's right. I've been reading, of course, the Iranian government's response to COVID-19, as you mentioned, was closely tied with their economic crisis and how to find a balance between containing the disease and continuing to have a vibrant economy. And many observers, when they look at India, for example, they mentioned that how rash the decision was to have a general lockdown in the country without having a program in place for sustaining livelihood of tens and perhaps hundreds of millions of people in India. Of course, in Iran. So this question, obviously, again, as you so beautifully illustrated, to think about the coping with the spread of COVID-19 is closely connected to how Iran is responding to its economic crisis, both in terms of, people say, management inside the country and the sanctions. So what grades do you give them in making that balance?
They are in the middle of doing that. You know, we haven't gotten the final exams yet, right? So we can't grade them. Iran faces a more stark choice than most countries because the government is broke. It has difficulty moving money around to pay people who are without jobs and to pay the poor. There is a preponderance of very small businesses, as I mentioned earlier, that are very hard to reach. And if you have shelter in place and stay-at-home rules, these businesses go under. And when they go under, they may not spring up. A mechanic who has abandoned his shop for 3 months and has lost his workers, he's not going to come back and start repairing cars. His equipment is rusty, he's lost his shop, maybe he can't pay rent. So the government was kind of slow in saying, everybody in place, nobody gets fired. He could have done that. We will find the money, we will lend you the money, just don't fire your workers. Later they said that, and in pieces and so on. So I think they get like a B grade in communicating to the employers that their duty, if you like, during this crisis is to hold on to their workers, not to sever those relationships that are very hard to rebuild. I think the other part of the challenge for the government was when to let people travel between cities and go to work, and when to expect its own bureaucrats, 2-3 million of them, to come to work. On that, I think they took a hasty decision. They panicked on the side of economic collapse and went a little bit in the direction of risking lives. One reason why they did that is very directly related to the sanctions. Why? Because if you have followed the debate in Washington among the hardliners, it's always like, we have sanctions that are succeeding because the economy is collapsing. So if the economy begins to collapse now, they are not going to go into the fine details that it wasn't sanctions, it was COVID. They're going to say, see, we succeeded. So the economy is in the front line of this struggle with the United States that the Islamic Republic has had for 40 years.
That's right.
That is a very distinct factor. In Turkey, they are doing a similar thing, but the economy is not protecting Erdogan. Nobody's going to say there's going to be regime change in Turkey because the economy is going down. A lot of people are opposed to interfere inside Iran as soon as there is demonstrations and so on. So what the government is doing is saying, we have a existential struggle in front of us to keep the economy going. It isn't just a matter of keeping unemployment low.
And in a sense, if I may interrupt you, in a sense, economy in Iran is politicized in such a way that any kind of economic project and decision inevitably has a very direct consequence in terms of the state politics.
It's a very well put. Yes, yes. The economy has become politicized, very much so. Yeah. And I think that explains this, what many have criticized, including Iran's own health minister, as a hasty decision to open up the economy. And we will see to what extent people themselves, who obviously like their lives, will do the job of coming out in a very cautious way. You know, in coffee shops, having distance between the tables, you know, in public transportation, staying a little distant from others. Unfortunately, the pictures I've seen don't bode too well. So I am expecting a resurgence of the cases and even possibly deaths in the coming weeks.
No, that's true. I guess one little break that in Iran people had was the coincidence of the rise of numbers with Nowruz holidays, and that inevitably kept the workplaces closed, and so that helped the government in a sense to have a lockdown without calling it a lockdown. It was just the New Year holidays closures.
Exactly. Although in terms of geographic distribution, it did the other. It did worse because people traveled.
Traveling was.
So they took it to all the 31 provinces of Iran.
Yeah. So I want to ask you one last question. I really don't want to let you go, but we have to do it. Yesterday, I was reading a piece in the Iranian newspaper Etemad about possibility of raising the minimum wage again in Iran. And the conversation was that, as you know, minimum wage has been increasing in the past 10 years, I don't know, like 500%, 600%. And the argument was that, you know, this kind of increase would push Iran towards a repeat of the Venezuela scenario, and it helps to increase the inflation to such a degree that the economy in Iran would collapse like Venezuela's case. But I wanted to ask you, what's the difference between Iran and Venezuela? Why Venezuela collapsed so rapidly, and the entire economic infrastructure disintegrated, while Iran could hold it together for the most part and operate relatively in a manner that can sustain people's livelihood without seeing this kind of mass migration and all that?
That's a very good question. A lot of people ask that question. What is the difference between two countries, both under sanctions, both on the doghouse of the United States? And the simplest answer is that Venezuela calls itself a socialist country. It looks up to socialists in how to run their economy. Markets, capitalists, there are not helpful people for that. In the view of Maduro, you don't go to markets, you don't go to employers. There's no negotiations there. Iran is not a socialist country. In fact, socialist is a bad word in Iran, just like in the United States. You know, we have Islamic economics. And ever since the end of the war, markets have come forward more so than before the revolution. Iranians have allowed Iranian government for relative prices to be very flexible. You don't find that in Venezuela. And you don't find that in any of the Persian Gulf countries that are having serious contractions because the export revenues have fallen. When you allow export revenues when export revenues decline and you allow your exchange rate, your currency to devalue, you're allowing the markets, millions of people, employers to help you fix things. And that's what happened in Iran. Maduro was running more of a command economy, and he did not allow devaluation. Money flew out of the country. You would be surprised, but people are actually taking money inside Iran, and maybe they're doing that right now as we speak, because Iran's stock exchange is the best in the world. It increased by 50% in a period of a month, right? So the market mechanism works in complex ways, sometimes in mysterious ways, but it makes for a flexible economy. So when you put pressure on it, it bends, it doesn't crack. When you have a very rigid economy, the pressure, either you completely withstand the pressure or you collapse. I think that's my short answer. But Iran is better among a lot of oil exporting countries. I mean, there is no comparison with Nigeria. Iran had 40 years of building a social protection system. Poverty rates have been coming down. They are a little higher now, but that happened only around 2005 in Venezuela, trying to address the problems of the poor. So Iran has had a much longer time to build an infrastructure, both in terms of institutions and roads and highways, electricity, natural gas, clean water. Those are things you really need at times of crisis like this. A person can lose his job in Iran, his electricity will come, his water is clean, he gets his natural gas. And he doesn't even have to pay the bills because it's the government, right? So you don't have that tremendous, and by the way, 2/3 of Iranians own their homes. I don't know what it is in Venezuela. So you have some basic lifestyle that is hard to hit, if you like. You can hit them with food. Yes, red meat prices have gone through the roof. A lot of people don't eat red meat anymore. But chicken prices are surprisingly low because Iran has an amazing chicken industry. And
so perhaps it's good for their health that they're not eating that much red meat anyway.
Exactly, that's what I told my mother. Eggs are there, milk is not so well produced, there are some shortages, but bread is available, it's cheap. So some basic stuff is running well in Iran. How long that will continue, I don't know. It's not, this COVID plus sanctions plus low oil prices should not be taken lightly. To look back in the last 10 years and say, oh, this is going to continue for another 10 years. So I'm personally very worried. And that is why I'm very worried for the average Iranian who had a decent life, who've raised their kids, looking forward to go to university. That's the Iranian dream, university, right? And a lot of those are coming under question. And so, and unfortunately, the sanctions do not help. United States is completely alienated, in my view, the Iran's middle class. Something that will have long-term consequences both for Iran, Iran's neighbors, and the relationship with the West. So this is time for people to think very hard about what is likely to happen.
I mean, I share your concerns, and I might add that we also do have those similar concerns about what's happening in the U.S. We live very close to New York City, and I don't know what kind of city would exist after this COVID-19 crisis ends. And surprisingly, we don't see that many people even touching that question, that what kind of city that would come back on the other side of this crisis. So these concerns are rather global, and we also feel it in our own homes in the US. Thank you so much, Professor Salehi. This was such an amazing conversation, and I really, truly appreciate it. And stay safe and healthy. And hopefully we come back to you if you have more questions soon.
Sure, my pleasure. Thank you for having me.
Thank you so much. Bye-bye.